COVID-19. We'll keep a close watch on all those numbers to make sense of what's happening in the country right now. We have Dr. Muffi Lakarwala. He's an advisor, BMC for COVID Jumbo Facilities. He's also Director of Surgery at the Sir H.N. Reliance Foundation Hospital in Mumbai. We have Dr. Suranjit Chatterjee, Senior Consultant, Internal Medicine, Indraprastha Apollo Hospital, joining us from Delhi, and Dr. Vivek Nangia, the Principal Director and Head of Respiratory Critical Care Medicine, Max Saket, also joining us. Dr. Mufazzal, if I can begin by asking you first about the big shot in the arm, the big story that we're tracking, which is emergency use authorization being granted to a third coronavirus vaccine, the Sputnik 5. Does this ring in some hope at a time when we're seeing this major rise in COVID-19 infections across the country?
Nishika, we are the most populous country, one of the most populous country with probably the second largest number of cases in the world. And therefore, we do know one thing is that the vaccine is the only way to blunt the edge of this epidemic, to decrease the number of hospitalizations, to decrease the number of severity of coronavirus cases. And we do know over the last week or so that we were probably falling short of the number of cases as compared to the number of cases that had to be administered the vaccine. We've probably administered close to 7 to 8% of our population. And therefore, another vaccine coming in, especially with the efficacy of 92%, really augurs well for our population. I think that's a great move by the DGCI.
Right. I want to also, though, ask you a follow-up question that the rollout of this vaccine is only expected by the first week of May. Does the timeline at all worry you, given the fact that we're still looking at a rollout a fortnight away?
Yes, I think we are already a little bit late in approval of another vaccine. I don't know the logistics of when they're applied and stuff like that. However, the second wave is well and truly here. And because of the problem that people are not following COVID-appropriate behavior, we will never get a control of the second wave. We've still got religious, we've still got political, we've still got various other activities that are going on in full swing. And it's not possible to control the second wave if we continue this behavior.
All right. Dr. Chatterjee, let's just shift our focus to Delhi for the moment, because lots of questions coming in from our viewers. There are 14 private hospitals now that have been dedicated exclusively to fighting COVID-19. What does this mean for patients who had elective surgeries scheduled, patients who are already admitted into, say, non-COVID wings in these hospitals? Do we have any clarity?
Yeah, it's a difficult situation right now with all the admissions. Like from yesterday, our hospital stopped admitting all regular patients that were planned for today. The surgeries have been all postponed. The non-COVID patients have been asked not to report to the hospital anymore. So it's going to be a difficult job. But what is more important is the patients who are admitted with us. What is going to happen to them? We have hospitals which are full. The ICUs are full because unfortunately at this time, unlike last year, the non-COVID cases were all coming to the hospitals, and the hospitals absolutely full of non-COVID cases as well, along with the COVID cases. So it's going to be a very, very difficult situation for the patients. It's going to be a tough task. And because even the non-COVID patients require treatment, and big hospitals like Apollo or for that matter, Gangaram, they all treat a variety of cases. There have been cases which have been scheduled from months in advance. There have been cases which come from outside Delhi. I think the patients are going to non-COVID patients are unfortunately going to suffer a bit.
All right, non-COVID patients are going to suffer, especially in the national capital. Dr. Nangia, what do you make of this move? It has been a sudden move to now dedicate 14 private hospitals exclusively to COVID-19. Like Dr. Chatterjee is saying, it's going to be extremely challenging for those who are, say, battling other conditions and are in critical care. What happens to those patients?
Yeah, I fully agree with Dr. Chatterjee. It is not going to be easy to be throwing all these patients out of the hospital immediately. I guess it will take us some time to create all those beds, but we'll do it. Sooner or later, we'll have to do it because this deluge of COVID patients that we're facing now, otherwise will, totally, put a lot of pressure on our healthcare system and make it difficult for us to survive otherwise. So I guess we'll have to create something, whether it means creating some artificial, like temporary structures and keeping patients there. Something of that sort will need to be done.
Dr. Nangia, what happens to elective surgeries?
Exactly, that's what I'm saying. That you can't even compromise on the care of the patients who are already suffering with non-COVID illnesses and require surgery. So there have to be some kind of a balance which will have to be struck. I guess some hospitals will have to be COVID, some will have to be non-COVID. That's the only way one can function.
Dr. Nangia, what happens to patients who have elective surgeries, scheduled surgeries in these hospitals?
So, the elective surgeries will probably need to be cancelled as of now because they're not emergency. We'll have to tackle with the emergencies. That's what happens in a war-like situation also, that you triage your patients and see that who requires a priority treatment and who does not. Those who have a minor ailment, those who have elective surgeries will probably have to postpone them. In any case, I would say it is not safe to carry out elective surgeries right now when there is such a deluge of COVID patients that they're also likely to catch COVID from within the hospital.
Right.
So I guess we don't have any choice but to, follow the line.
All right. Well, that's an interesting take, Dr. Nangia, at the moment, that if your surgery isn't, it isn't an emergency and it can perhaps wait, then it may be a safer option for you to defer it as well, given the extent of the pandemic right now. We also have Dr. Devendra Nayak, Medical Director, Sri Balaji Super Speciality Hospital, Raipur, joining us. Dr. Nayak, one of the characteristics, the worrying characteristic of the second wave of COVID has been the proliferation to rural areas as well. It's not just a high-rise or an urban phenomena. As someone who's based in Raipur, are you seeing a huge influx of patients from rural areas? What's your assessment?
Basically, Chhattisgarh is the small state, and we have seen there the explosion of COVID. And this COVID is exploding like everything, like they are coming from the Maharashtra border, and now they are encroaching to the rural area also. It's a situation is like that. This is the explosion like of these things because of the small state. There is the small facility is there. So this rural area, they are affected more because they don't have infrastructure facilities like metros. And the things is that the Maharashtra border, they are affected most, like the Bemetara, Rajnandgaon and the this Durg district.
Yes.
They are affected more, and now and they are migrating to the capital like Raipur.
Right.
So but anyhow we could manage that. But the things is that the rural populations, the advantage is that they are mostly a crowdless and their immunity is good.
Okay.
But this time of situation, the infectivity is 2 to 3 times more than the previous one. So this type of situation is there, and people are neglected usually. Like
Right.
they are like neglecting this COVID virus this time. So we are facing this the tremendous outgrowth of the COVID virus.
All right. So worrying story even in a small state like Chhattisgarh, and what you're saying is that there is a lot of influx of patients into a city like Raipur from adjoining rural areas in Chhattisgarh as well as Maharashtra. So, a lot of pressure on the healthcare system as well. Dr. Mufassal, I want to come back to you on the other big story as far as Maharashtra is concerned. It is the worst hit state, even though there has been a slight dip in the numbers in the last 24 hours. Does that A, indicate that the weekend lockdown worked, and B, is it just a matter of time now, before, say, a major lockdown is announced in the state? Because it does appear at the moment to be the only way to break the chain of transmission.
I think the Chief Minister has given umpteen warnings to the public that please use appropriate behavior, otherwise you will leave me with no choice. Because when we fall short of hospital facilities, when we fall short of drugs like remdesivir, or fall short of oxygen, how much can you expand? How much can you put an effect on the medical doctors or the frontline health workers, including the nurses? So I think we've left him with no choice. I do believe that the numbers have come down, probably because not so many people have gone for testing. It's too early to see the dip in numbers because of a weekend lockdown. I think to see the effect of break the chain would take between 10 to 15 days, because people who become positive would already be there. So I think it will take a little while, but I think we are headed for a lockdown in Maharashtra. And we've given this period of time for the migrant workers to avoid that crisis. Probably for those people who want to leave, those people who want to stock up, to do that bit in the last week or so.
All right, so a lockdown in the state of Maharashtra is imminent, perhaps the only way to break the chain of transmission at this point. 14 private hospitals in the national capital have been dedicated to COVID. This is going to compromise non-COVID care for patients. And meanwhile, a worrying story as far as the rural proliferation of the second wave is concerned. Dr. Nayak, Dr. Mufassal, Dr. Suranjit and Dr. Nangia, thanks so much for sparing your valuable time this morning and being with us on NDTV. We will continue